Hey guys, how you doing? So in this video I want to discuss those situations where all-on-4 dental treatment or taking out all your teeth and having dental implants is a really bad idea. Now, last month I had maybe between 6 and 8 consultations with patients who had never seen me before, but they've got some kind of complex situation that they need help with. And 3 of them were people who came in saying that they want to have all their teeth out and have implants and have all-on-4. Specifically, I think they used the name of all-on-4 in the treatment. And in each case, I genuinely thought it was the wrong thing to do. And the really sad thing is, and in one of these situations, one of these guys, that he'd been to 2 dentists previously, and both of those dentists had recommended to take out all of the teeth, have the implants, and start again. And when I looked at the x-ray and when I looked at this guy's mouth, yeah, definitely some teeth needed to be removed, but about 60 to 70% of his teeth could have lasted another 10, 15, 20 years. And it's really sad to say this, and I'm kind of making a judgment. I don't know the dentists involved, but they were putting their own financial gain in front of finding out the best treatment plan for the patient. Now, before we go into the details of when all-on-4 is bad, when it's good, let me give you a kind of a history and pattern that I'm seeing among the vast majority of the patients who I see who need to have all of their teeth taken out and start again. And the story always starts in childhood, where they've seen a dentist and this dentist was horrible. They had a really terrible experience. Maybe it was taking teeth out, maybe it was fillings or anything like that. But if you think about it, 20, 30 years ago, dentistry was primitive. Really, it seems like it was really primitive. And there was always this kind of power difference where dentists said something and that was gold. Patients would always listen. Thankfully, this stuff is reducing now. I think it still exists a little bit, but it was a situation where your parents would take you to the dentist would inflict pain, and your parents, who you're trusting, they would be like, hey, little Johnny, that's fine, let Mr. Dentist do whatever he needs to do. And as a kid, that's a terrible and terrifying experience, and therefore you would never go to the dentist again, right? That's human nature. And a lot of my patients say exactly the same thing. So they avoid going to the dentist through, when they're young adults and all the way after that. And they only go to the dentist when they have pain. And the way dental disease works, whether it's gum disease, whether it's tooth decay, anything like that, it starts off and it's absolutely silent. You won't feel it. You might get a bit of sensitivity, you might get a little bit of bleeding when you brush, but that's pretty much it. It's not really toothache. Over time, it will develop into toothache in the vast majority of cases, or sometimes the teeth just break off and that's pretty much it. So what happens is, over this period of time, my patients would only go and seek a dentist when they were in really bad pain, and then they have the option of either going through a lot of treatment, which they hate the dentist, so they're not going to go through a lot of treatment, or have the tooth out. And having the tooth out is the quick and easy option. And it carries on like this until you get to the point where the overall dental health is so bad, it's causing so many problems, that it becomes worth it for the patient to find out a solution to actually fix the teeth. And then they consult Dr. Google, because that's the easiest thing to do, and they find out about this amazing treatment called all-on-4. And all-on-4 promises to give you this amazing smile. The before and after photos are really, really amazing, and it can all be done in a day, and it costs the same as having your medium-sized kitchen redone. And it seems like a no-brainer to go ahead and do this treatment. So the patient picks up the phone and says, hey, look, I'm interested in all-on-4, can I book a consultation? You go see the dentist, and you're almost already categorized into having all-on-4 treatment. Now, the truth is that all-on-4 treatment is a fantastic treatment for the right patient, but it may be that your situation can be improved a lot without having your teeth taken out. And here's a photo of a guy who was exactly in this situation. You can see that his smile does not look great. There's a lot of things he hated about his smile. He would walk around with his hand in front of his mouth. He was so ashamed of his smile, and it took him a lot of saving up and a lot of guts to actually come and see. He ended up seeing me, and we looked at all of the options. Now, although the teeth don't look great, I know that these teeth can be made to look a lot nicer. He's got a lot of spaces, so dental implants would be appropriate, but actually budget was holding him back, and we always try and find the maximum benefit that someone can get from within the amount of money they want to spend at the dentist. So we actually decided to clean his teeth up. That would help with the gum disease, and then we used a combination of veneers, crowns and bridges to effectively restore his full smile. Now, this guy's in his probably late 30s, early 40s, and this is quite important when it comes to all-on-4 treatment, the age of the patient, because if you think about it, if we assume that the life expectancy is going to be up to 80, 85, 90 years old, something like that, then whatever we do has to last all of that time, because typically taking all your teeth out and having implants is the last option. And when I tell people how long stuff lasts with its crowns, bridge, implants, all this, I tell people it's decades. The truth is I don't know. With implants, a lot of it depends on how well you maintain it, and a lot of these patients have got gum disease and maintenance hasn't been high up on their priority list, you know, seeing the hygienist and things like that. So we have to design this treatment, or we have to look at the overall patient care, not the immediate, hey look, let's do this treatment, it's going to cost you £15,000 and all your problems are solved, because really they're not. So with this guy, what we did, you know, we built up the whole smile. But more importantly, what we did, we always left the door open to have implants at a later date. Okay, so if what we've done now, if that lasts 10, 20 years, that's fantastic. We've delayed implant treatment for 10, 20 years, and he can always have that option of implants later. Now, if you've got all-on-4 and you've got bone loss around an implant and things aren't looking great, things can be done to fix that situation, but it's not easy and it's definitely not cheap, and most dentists won't be able to help you with it. Okay, it's a really complicated situation. So I always think if you can delay treatment and look for a more conservative treatment option, then that is probably the better option. Now, if you go to dentists or clinics like where I work, where a lot of us are general dentists with the help of specialists, then what happens is you get more treatment options that way. There's a whole bunch of clinics popping up, and they tell everyone that they specialize in all-on-4 treatment. And I work quite closely with one of them, and the problem I find is there's almost a bias to have all-on-4 treatment, because they reject all the other treatments, and you're almost limited. You're self-diagnosing yourself, saying, hey look, I want to have all my teeth taken out, and this is what I want to do, and they're selling that product, so they're going to be like, yes, come to us, we'll take out all your teeth and you can do all-on-4, and it's really attractive. Their pricing is really cheap typically. So definitely go and see those guys for a consultation, but try and see at least 4 or 5 other dentists. Okay, each dentist is going to have a different bedside manner, each dentist is going to have a different value set, each dentist will probably give you slightly different treatment plans, and each dentist will definitely give you different costs for different treatments. So I think it's really important to find someone who you're comfortable with. The fees are all discussed up front, there's no hidden costs and stuff like that. You know exactly where you stand, because it's not about having that one treatment, it's really about the long-term care that you're going to get from that dental clinic. So I hope you found this useful. I hope you can see where I'm coming from. A lot of people say, look, get in contact with me saying I want all-on-4 and stuff like that, but the truth is, until you see a dentist who can give you all your options, you don't know what the best treatment for you is. Conversely, I actually get comments from a lot of people saying that they've had all-on-4, but they don't like it for X, Y, and Z reason. Okay, and what could we do to improve that? The truth is, when you've had all on four, once the implants are in, it's very difficult to make changes at that stage. So, be mindful of all your options and go for the best kind of long-term option. So if you got something out of this video, please hit like, leave me a comment below. I'd love to hear your story on this. So take care.